Let's move on to the number 9 speaker. The number 9 speaker is Dr. OTHMAN. She's going to the topic is going to is to enhance the surgical skills training among the ophthalmology resident in Brunei.
Thank you, Professor. Good morning, everyone. My name is Dr. Fitri. I'm from Brunei. My project that I had to do is to enhance surgical skills training among the ophthalmology residents in Brunei. So as an introduction, as you know, Brunei is quite a small country. We have quite a limited number of ophthalmology residents. There are only 7 of them, 3 seniors and 4 juniors. So the objective of my project was to assess the current challenges faced by the residents and also to propose targeted interventions to improve the surgical training. So firstly, what we identified from the key challenges, we've asked the feedback from the consultants that were training the residents. There are quite a variable competence levels among the senior and the junior residents. Among the senior residents, they are quite confident in the cataract surgeries and also the surgical procedures, but there are some that needed remedial training, and that goes the same to the junior residents as well. They've also feedback that there were unequal surgical exposures among the residents as well. They've found out that some had more OT time compared to the rest. So the objective for my project was to standardize this training to bridge all these competency gaps and also to optimize OT opportunities for all the residents. So I did a survey to all the residents, and the survey's key questions was targeted in obtaining their confidence level in performing basic and intermediate surgeries, the current training methods that they do, any barriers to skill development, and also their suggestions for any improvements. So from this survey, we've asked how confident they are in performing cataract surgery and also the ensuturing trauma repair. The feedback was that there was a wide gap of confidence level among the residents, depending on which rotations they are. So one of the feedback was that those that were in the vitreoretinal rotation received less cataract exposure training. However, with suturing techniques, there is no issues among the residents, but they do have low confidence in corneal suturing and globe repairs. So what are the training methods that they've encountered during this residency training? So most of the training were live surgery, so 85% of them. There were very limited wet and dry labs training opportunities, and there is no virtual simulation opportunities. There are a bit of peer practice sessions that they do among themselves. Other challenges identified were limited OT time with supervisors, meaning that the list there is no specific OT training list, so it's all the supervisors list, so they had limited sessions with them. The lack of wet lab opportunities, and also financial constraints for overseas workshop and surgical skills training. So the suggestions from the residents were they needed more wet lab sessions before doing live surgeries to get more confidence, funding support for overseas wet labs, so getting grants, increased supervisor debrief sessions after every surgeries that they do, and also peer review, so video-based feedback sessions on their techniques and what they can improve on. So what I have done in terms of the interventions based on the survey, we've started on a short-term basis, a basic baseline skill assessment where the consultants that train them would do an initial assessment, and we have set up a dry lab setup using a synthetic eye. And I've also organized a structured simulation. So we've dedicated an OT training list weekly. So I've made a specific session for the trainees once a week so that they have more time to learn their surgical training. And we've also introduced a low-cost simulators, which is the synthetic eye. I've also encouraged and started the mentored surgical training where most of the senior would coach the juniors, but in a supervised setting. And we've had sessions where there is feedbacks on their video recordings on their surgical techniques. So post-intervention, I did a repeated survey, and from that survey, we found that the confidence level of the trainees have improved a lot more than before. And they are quite happy with the standardized training for all the residents, and they feel that they are better prepared graduates before becoming independent practice. So my conclusion and what are the next steps. So the survey did confirm that there are key gaps in the surgical training. The proposed interventions are quite feasible and it's quite resident driven. I think the next step that we need to do is to get some funding and grants for simulations and surgical workshops. And perhaps some regional collaborations with partners around the ASEAN country. And also, if budget permits, we could get some virtual training modules and get grants and fundings. And that's it. And I would like to take this opportunity to invite everyone to Brunei in November. We have the ASEAN Ophthalmology Congress.
Thank you, Dr. Othman. Is there any question from the audience?
So I think it's good that you're looking at the problem while it's still a small, it's still a small program, and then start fixing it before it becomes bigger. So good luck on that one. I wonder if there's what licensing issues you have in Brunei that you may do it the other way around. Instead of sending trainees out, you can get trainers in. That could be an option. Depends on your licensing requirements as well. Because some smaller countries do that. They bring in specialists from other countries, maybe go there on locum for like 2 weeks to a month just to train residents and other specialists. I'm not sure what the medical licensure issues would be there, but that's something you can look into.
Thank you.
So might be cheaper than sending them
cheaper
out.
than sending them out, that's true.